Giving someone the choice to live or die really truly ethical? Physician-assisted suicide should not be legal because it gives the sick a false financial hope, it interferes with religion, and it puts pressure on everyone involved. Even though physician-assisted suicide is only legal in 4 states, it may become legal in your state. Physician-assisted suicide is the same thing as death with dignity. The euthanasia is different. The Death with Dignity National Center states that physician-assisted suicide is when the physician gives the sick a drug that then they take on their own. The euthanasia is when the physician gives a shot of a lethal dose to the patient. Therefore, they're different. I chose this topic because it is important for everyone to know why it should be illegal. First, we will learn why physician-assisted suicide should be illegal because it gives the sick a false financial hope. Second, how it interferes with religion. And third, how it puts pressure on everyone involved. Let us learn why it should be illegal. Physician-assisted suicide should be illegal because it gives the sick a false financial hope. Hospice and end-of-life care are very costly, so the sick feel like taking away the burden of the cost for their family by dying is a good thing. In 2010, Medicare paid $153 for day-to-day end-of-life care, according to Hospice and End-of-Life Care Costs and Options. The drugs that are used for physician-assisted suicide are far less expensive. The drugs cost from $35 to $50, which is much cheaper according to Golden. However, when the patient takes physician-assisted suicide, they're not ending life in the way they might have thought. 80% of Americans wish to die in their home. And with physician-assisted suicide, that cannot happen. Physician-assisted suicide may trick the sick into thinking that they are getting a false financial incentive, but they know they're interfering with religion. Physician-assisted suicide interferes with many religions in the United States. According to Gallup Daily, 77% of Americans believe that they are Christian. According to ProCon.org, Christians strongly oppose physician-assisted suicide. Christians think that it violates the sanctity of life and that God gives life, therefore he should be the only one to take it away. Christians aren't the only ones who think that. Buddhist believers also believe that. According to the top 5 of anything, Buddhism is the 4th most practiced religion in the United States. Damien Cow, a Buddhist college professor, states that the bottom line is that so long that there is no intention to take life, no moral problem arises. Damien Cow says that Buddhists strongly oppose intentional taking of life. They think it is wrong that physician-assisted suicide is legal. Hinduism also believes the same thing. According to the top 5 of anything, Hinduism is the 5th most practiced religion in the United States. Hinduism believers believe that taking someone's life can result and will result in bad karma. Not only does physician-assisted suicide interfere with religion, but it also puts pressure on everyone involved. Another reason why physician-assisted suicide should be illegal is because it puts pressure on the sick. Not only does it put pressure on the sick, but also the family and the physician. It is hard to believe that the physician is impacted by physician-assisted suicide, but they are. Patrick Matheny, a man with ALS, struggled with the decision to end his life. He would set a date and move it back. He would set another date and then move it back again. Obviously, he felt pressure with the decision to end his life. On the day he finally decided to end his life with physician-assisted suicide, he couldn't even take the medications on his own. According to Wisconsin's Right to Life, Joe, Patrick's brother, had to help him with the medication. Joe said to the press that it is too personal to talk about what went on in that room. But But Joe did tell the press that it doesn't go good and smoothly for everyone. For Pat, it was a huge problem, and it wouldn't have worked without my help. Howard Brody, a professor, states that people who use physician-assisted suicide impact their family. Their family is impacted by the sick's choice to end their lives. The families have prolonged depression and grieving. The family also has a lot of anger built up. Not only are the sick and the family affected, but so is the physician. The Hippocratic Oath is the oldest legal binding document known to man. The Hippocratic Oath is still taken by physicians today. It states that the physicians will pass the medical secrets down to the next generation. They will keep their patients' files private, and that they will do their best for their patients. Now, is doing their best for their patients really going to let physician-assisted suicide take place? Miracles can happen, but with physician-assisted suicide, miracles won't happen. Physician-assisted suicide should be illegal. Physician-assisted suicide interferes with religion, it puts pressure on everyone, and it gives the sick a false financial hope. First, we learned how physician-assisted suicide should be illegal because it gives the sick a false financial hope. Second, how it interferes with religion. And third, how it puts pressure on everyone involved. Is giving someone the choice to live or die something America really wants to be known for? It is not okay to give someone who is already hurting